Across the United States, 300 to 400 physicians a year die by suicide. That's according to Dr. Brian Weis, Texas Tech University Health Sciences Center School of Medicine Regional Dean. We spoke with Dr. Weis about how this impacts the entire health care spectrum and how they are tackling it. That is, we bring awareness during Suicide Prevention Month tonight.
There's multiple factors here. I think the two main that come to mind is first of all, it's just the nature of the business we're in. You get to nurses and doctors, and a lot of times we're dealing with those same issues of just obviously seeing people suffer, and so you can't help but be affected by that.
Dr. Weis says that the second thing is the stigma of losing their license if they admit they are vulnerable.
A lot of times when we apply for our licenses, and that for doctors it's every couple of years, there used to be these questions on license asking, basically asking, have you sought help for mental health issues? And there was this fear of, what if I put yes?
Dr. Weis adds that a lot of times when it comes to physician suicide, it's usually during a time when a physician is being sued for malpractice.
And you talk about this perfectionism. Unfortunately, that is essentially the expectation for doctors, right? And when you do make a mistake, which we all do, we're all human, okay, the question is, am I going to be sued? Have I caused harm to someone?
Dr. Weis adds that a lot of time, the stress starts at the time of training and says that they are being much more aware of that.
There's now a lot of regulations and guidelines that are limiting the number of hours residents work, the number of patients they can admit to the hospital on a given day. Again, trying to find some balance. What we're finding is, like at TTUHSC, is we talk a lot about wellness now, okay? Student wellness, resident wellness, faculty wellness. We have committees that's their whole job is, what are we going to do next to make sure that we have some activity that we're trying to help people find that balance between work and life.
Tracy Summers, Area Director for the American Foundation for Suicide Prevention, says it's okay to ask for help, making sure those in the medical field understand that they are providing the care, but it's also okay for them to receive the care as well. To see more of Mari Farrell's sit down with Dr. Weis for an extended look at this issue, go to our website, myhighplains.com.